So the skills that you picked up during the day and also the equipment that you took away with you, would you use that in your clinic for patients?
I actually already do. So I use the Stop My Stoop wedge and measuring equipment already in clinic. I find it really helpful for a lot of our patients, especially these days where everyone's desk-based or they're working from home, so they don't have necessarily the best ergonomic desk setup. So you see a lot of people that are quite compressed sort of through the chest or quite tight through the chest or forward head postures. So using the equipment, one, it gives me something that I can measure before and after, and then the patients love that because then they can see that change has been made. And also just using it through treatment, the wedge I find so helpful in helping patients to even things like their breathing mechanics, their overall posture is already improved by working on the wedge. It can be combined in treatment even when you're not aiming to treat the upper back and neck as such. I find that sometimes with patients that would benefit from more full assessment, full treatment approach, in the fact that even if I'm treating something to do with the lower extremity, I find just treating them on the wedge and then being on the wedge, then when I remove it, their posture's better, their breathing's better, and it just helps with the overall treatment outcomes as well. So I use the wedge quite a lot as part of my treatment. So yeah, I find it really helpful.
That's great, thank you. And lastly, what will you tell your fellow practitioners about the day?
It was just a really fun experience. Joe and Trevor, who run the course here, are really friendly. They make you feel really welcome, they make you feel like you're part of the family, and they're so knowledgeable that they just love to share all their knowledge. So it's just a generally really lovely experience, and it's it's busy because it's a popular course, but it's not too many people that you can't really make the most of it, or at least with the fact there's Trevor and Joe and other team members that are around helping you, you don't feel like you're not being constantly assisted and helped, and you can always ask questions and things like that. So it was a generally really nice experience, and I felt like I actually received a lot of treatment myself through the day. So it was really good to feel what you were learning on yourself, and vice versa, like how it feels to give it and get feedback from someone who is a fellow practitioner that's doing the course. So yeah, it was just generally a really nice experience, a lovely day.
Thank you so much.
No, pleasure.